As the world moves fast and time passes by, 1 in 24 Americans will be diagnosed with colorectal cancer, which is the second leading cause of cancer-related deaths in the United States. However, the good news is that most of this can be prevented if the 1 in 3 people who are not up to date with colon cancer screening can be evaluated in a timely manner. Colorectal cancer starts as polyps, which, if left untreated, can grow to become a cancer. The best prevention tool is a screening colonoscopy. Our colonoscope is a flexible fiber optic tube that is 5 feet long and half an inch thick, with a camera and light source at the tip. Colonoscopy is an outpatient procedure and will take around 30 minutes. It is performed under sedation so that you'll be comfortable throughout the entire procedure. The colonoscope is inserted into the rectum and advanced up to the end of the colon, called the cecum, or sometimes to the part of the small intestine called the terminal ileum. Reaching the cecum is an important quality measure in colonoscopy. It is possible to take pictures and perform biopsies during colonoscopies. However, to perform a thorough and complete examination, the colon must be clean, otherwise polyps can be missed. The colonoscopy prep on the right side of the screen is very poor, and it's very difficult to see any small polyps which may be lying underneath the layer of stool. On the other hand, when the colon prep is adequate, even small polyps can be seen easily. Therefore, it is very important to follow your doctor's instructions regarding bowel preparation before undergoing colonoscopy. During colonoscopy, all visualized polyps should be removed. However, not all polyps can be seen easily. It is estimated that 20% of polyps, particularly those small in size, can be missed during colonoscopy. At the Orlando Digestive Health Institute, we use a novel technology during colonoscopy called artificial intelligence to enable identification of polyps. By combining the latest technology with a thorough examination of the colon, the physicians at the Orlando Digestive Health Institute are able to exceed all recommended quality measures in colonoscopy. While polyps are of different types, they are broadly classified as sessile polyps that have a flat base and pedunculated polyps that have a stalk. Generally, pedunculated polyps are easier to treat than sessile polyps. The best method for removing a polyp largely depends on the size and shape of the polyp. The physicians at Orlando Digestive Health Institute have developed a sophisticated and evidence-based algorithm for optimal management of colon polyps that will ensure success in 99.9% of our patients. For pedunculated polyps, the hot snare polypectomy method is the optimal technique. In this patient, a 15mm pedunculated polyp is seen during colonoscopy. The stalk of the polyp can be injected using a solution containing a blue dye and is then removed using a snare and applying cautery. This technique is called hot snare polypectomy. While small polyps can be removed using biopsy forceps, the removal is oftentimes incomplete and the polypoid growth can recur. It is estimated that 20% of polyps, particularly large lesions, recur after polypectomy, oftentimes because removal was incomplete. We therefore recommend using a snare for removing even small polyps, and the technique is called cold snare polypectomy. 25% of polyps seen at colonoscopy measure more than 10 mm in size, and they are of different types depending on the underlying pathology. As larger-sized polyps are at an increased risk for turning into cancer, we routinely use advanced imaging techniques to evaluate these polyps so that they can be treated appropriately. Usually, polyps less than 20 mm in size can be removed by polypectomy with or without injecting their base. When a solution is injected to elevate the base of the polyp prior to removal, the technique is called injection-assisted polypectomy. This is usually done as a safety measure to protect the deeper layers of the colon wall. Unlike the previous polyp, Polyps larger than 20 mm in size can be challenging and difficult to remove, and these are called difficult polyps. At the Orlando Health Digestive Health Institute, when we encounter such difficult polyps, we refer our patients for treatment to specially trained interventional endoscopists at the Center for Advanced Endoscopy, Research and Education, known as CARE. Depending on the depth of growth within the wall layers of the colon or the rectum, the polyp is removed by advanced techniques called endoscopic mucosal resection, also known as EMR, or by endoscopic submucosal dissection, known as ESD. This patient with a large flat polyp underwent endoscopic mucosal resection. Endoscopic mucosal resection involves the injection of a solution mixed with a blue dye in order to delineate the polyp margins and to elevate the polyp away from the muscle layer. Using a snare, the polyp is then carefully removed in a piecemeal fashion. We treat the margins of the resection site by application of cautery, as it has been shown to decrease the rate of polyp recurrence by more than 15%. Delayed bleeding can happen after resection of large polyps. Therefore, in such cases, we close the resection site by placing clips, as it can prevent delayed bleeding. Endoscopic submucosal dissection is performed when the polyp involves the deeper layers of the colon or the rectal wall, or if early cancer is suspected. In such cases, the lesion must be removed in one piece to ensure complete removal of the tumor. As you can see in this patient with an early cancer in the rectum, a special cautery-enhanced knife was used to remove the cancer. While ESD is more technically complex and invasive than endoscopic mucosal resection and is associated with higher rates of adverse events, it is generally safe when performed by experts with specialized training. ESD was performed safely in this patient and has avoided major surgery. At the Orlando Health Digestive Health Institute, we are successful in removing more than 99% of benign polyps, thereby avoiding the need for major surgery. In a research study, we have shown that patients treated by endoscopy have shorter length of hospital stay, and the technique is less costly than surgery by $10,000. Do you want your colonoscopy the Orlando Health way? To find out more about colonoscopies and other endoscopic procedures, please visit our website at www.orlandohealth.com/DHI and discuss with your family physician.
At Orlando Health,
we care about your colon.